As of 2026, health insurance premiums in Georgia are higher than they were just a year ago. Healthcare costs can be confusing. Policies change, prices shift, and it's not always clear why. This video breaks down one issue affecting families across the state: rising healthcare premiums in Georgia. Across Georgia, many families are now paying more for health insurance. Monthly premiums have risen, coverage has become harder to afford, and people are left wondering what changed. The increase isn't tied to one single decision. It's the result of multiple federal policy changes that have taken effect at the same time. For several years, enhanced federal subsidies helped lower the cost of health insurance. These subsidies made monthly premiums more affordable, especially for working families and older adults. At the end of 2025, those enhanced subsidies expired. Without them, many Georgians are now seeing their premiums rise sharply, in some cases, more than doubling. In Duluth, Georgia, one resident estimates that keeping the same health plan would cost about $1,100 more each month. Without subsidies, that monthly premium would rise to more than $2,300. At the same time, new federal rules have changed how Medicaid and the health insurance marketplace operate. Together, these changes are reshaping how much people pay for coverage and who can stay insured. Georgia has been especially impacted. The state already has one of the highest uninsured rates in the country, and nearly 1.5 million residents rely on the Georgia Access marketplace for coverage. When federal support changes, the effects in Georgia are immediate.
Last year, with the plan that I had, was $30.69 a month. This January, they want me to pay $270.86. So it went up 9 times. So therefore, I cannot afford that.
Behind these policy shifts are real people now making difficult choices. For many Georgians, higher premiums don't just mean paying a little more each month. They mean adjusting household budgets, delaying care, or deciding whether insurance is still affordable at all.
So I did not renew my 2025 plan for 2026 because it went from $387 a month to $819 a month. And that is not possible for me. So I am currently uninsured.
Without enhanced subsidies, the average monthly premium for many marketplace enrollees has more than doubled. Families who once paid manageable amounts are now facing increases that put real strain on their finances. Some people have responded by switching to plans with higher deductibles and fewer benefits. Others have decided they can't afford coverage anymore and have dropped it altogether. These individual decisions are adding up. Over time, hundreds of thousands of Georgians are projected to lose health coverage. The effects are not evenly distributed. Rural communities, older adults, and people with chronic conditions are being hit the hardest, especially in areas where access to care is already limited. The ripple effects reach the broader economy as well, impacting jobs, local businesses, and community stability. Rising healthcare premiums are serious, but they are not inevitable. Even as federal policies have changed, Georgia still has options. State leaders can pursue solutions that protect affordability and access, such as closing the coverage gap, supporting state-based affordability programs, and making it easier for eligible residents to enroll and stay enrolled in coverage. Georgia can also strengthen the systems that help people navigate health insurance, so fewer residents fall through the cracks.
Since Georgia is a state-based marketplace, the state has the authority over key parts of how the marketplace operates, including enrollment rules, consumer assistance, and certain affordability and system design decisions. States that rely on the federal marketplace, i.e. states using healthcare.gov, do not have this same level of control. While state actions cannot fully undo federal rollbacks, they can reduce coverage losses, help stabilize the insurance market, and protect access to care for Georgians most at risk of losing coverage. How Georgia uses this flexibility matters. State policy choices will play a meaningful role in whether Georgia families can stay insured despite what happens in Washington, D.C.
And community voices continue to matter. Health professionals, faith leaders, educators, and advocates all play a role by sharing information, raising awareness, and participating in conversations at the local and state level. Georgians who rely on Medicaid or the health insurance marketplace can make a difference by sharing their experiences and helping policymakers understand what these programs mean for real families.
Dear leaders, especially the main one, to understand that people can't afford health insurance in this country, being the richest country in the world, and yet lots of us are going to have to go back to nothing or go back to county health department or things that don't really work very well, because that's all we have.
If you really believe that small businesses are the backbone of America, then you wouldn't run us back to working for corporations because we can't afford to go to the doctor, because we can't afford a health care policy, we can't afford insurance. I love my small business, but in the past 6 months, I have doubted my ability to keep doing this more than the last 10 years.
Healthcare policy can feel distant and complex, but its effects are personal. Understanding what's happening is the first step toward protecting access to care across Georgia, today and in the future.